Hey, I'm David Rose, CEO of CortiCare, and I'm here in the podcast studio, and I'm joined by Gil Solano, our Vice President of Clinical Integration and the host of the CortiCare Podcast. And Gil and I just wanted to take a minute and thank our subscribers and listeners as we celebrate 1 year of the CortiCare Podcast. Thank you so much for your support. We've had so many great guests on, from epileptologists, neurologists, EEG technologists, best-selling authors, and we've got a great lineup all ready for year 2. So stay tuned, keep watching and listening. Thank you so much. You will notice that Gil looks a little bit different today. So Gil, What do you got going on today?
Well, I look a little bit different, and I'm sitting in a different place. I'm usually in your chair, but I thought it would be cool to give you that chair, and so I could experience what the guests feel like. And I am in my scrubs, as you can probably see. And what we're doing is CortiCare is sponsoring and offering me to go into EEG departments, neurodiagnostic departments in hospitals, and do like a 1-hour lecture that you can actually use towards your CEU credits. I gear these discussions to really target questions for the board. So I just want to say thank you for letting me do that. It's a dream come true. I travel around the nation meeting EEG techs, just like yourself, probably if you're watching and you're an EEG tech. And it's a really great experience, and I'm having the time of my life.
That's a real great thing you're doing. It's awesome. So thank you all. Gil, thank you, and we'll see you soon.
Sometimes the first time in these people's lives, the answer to, can I do that? Is sure, go ahead. They're surrounded with people, all of which have epilepsy. They develop these friendships that span the years. Many of the campers actually, when they age out at 17, become counselors.
Dr. Paige, I'm extremely excited to have you on. You look at epilepsy differently. First of all, you're an epileptologist, so this is your specialty. But you really have focused on comprehensive support for the patient and the patient's family. Before we start, if you could, give me a little bit of a rundown of who you are, what you've done, and then I would love to talk about how or what comprehensive support looks like for patients and families.
Okay. Well, I'm an academic epileptologist. I'm faculty at Ohio State University in their epilepsy division in the neurology department. Before medical school, I was an electrical engineer for 7 years in the aerospace industry. And so I focused exclusively on the diagnosis and treatment of epilepsy patients.
Very good. And so the comprehensive work that you're doing, the comprehensive support you're doing for patients and families, how did that become something that you wanted to focus on and really help these patients and the families with epilepsy?
Well, it's hard to see patients in clinic and hear their story and hear the impact that epilepsy has on their life, and not really want to dig deeper into the burden of having epilepsy. It's a very unusual disease in that it is the prototype for really an intermittent disease. It's there, and it's gone. And when it's gone, most patients are truly normal.
Yeah. And do you think that that's something that patients struggle with, is kind of the stigma of, well, you look normal, you seem normal, but all of a sudden you can't come to work because you say that you had a grand mal seizure in the morning? Explain a little bit about the struggles that patients have with that.
Sure. So not only not showing up to work, but having one of the most unusual things that any of your colleagues has ever seen a human do is huge stigma label, but the uncertainty of when something is going to happen, the dependence on other people, also with caregivers, the extra responsibility that has to be taken on, to supplement what the patient may have provided otherwise. it's a very difficult disorder that I don't think is generally appreciated.
Yeah. Yeah. Or even understood.
Certainly not understood.
Yeah. And so you've developed this passion to take care of patients and support them and support their families. What have you done? You and I talked a little bit off camera about some camps that you've put together. Tell us a little bit about that.
Well, I'm the medical director of Camp YouCan, which is a sleepover summer camp.
Yeah. And it's Camp YouCan?
Camp YouCan.
Okay.
All one word.
All right.
In Omaha, Nebraska, that I go to every summer and am able to hang out with the kids and goof on them. And it's just a really great experience. But it's really, I think, important because this may be the first time in their life that they were ever told, sure, go ahead.
Yeah.
Go ahead on.
Yeah.
Whereas previously they were like, oh my gosh, no, oh my gosh. Not only that, but the parents, sometimes for first-time campers, you have to literally peel the kid off of them because they don't want to let go.
Of course.
And by the time the camp is over, 3 days or so, the kid really doesn't want to leave.
Yeah.
And so we typically have a question and answer session with parents, the doc, and all the camp counselors. Pull your chair into a circle, 40 people or so, at the drop-off day and at the pickup day. And so even though I'm not a pediatric epileptologist, I certainly get a vision on what the issues are with pediatric population and what their parents are concerned about and what the support is like. The other thing that I do feel that's important by way of education is for me to attend support group meetings.
And this is for the patients or the patients' families? Or
Yes.
for both?
Yes. Yeah. So a lot of times patients, advocates, and their families will attend these support group meetings. And a lot of times it will be a scenario where I'm just kind of sitting in the back and the discussion is somewhat free form. And when it comes to a topic that there needs to be some technical reality added to, for example, someone may say, I heard that there's this new drug that does this and makes you lose weight and grows hair. Mm-hmm. Me being in the room to be able to comment on that, I think is an important educational component. And education is huge in epilepsy. It is a very unusual, ghosty disorder. Like I said, people are 100% normal, the best you can tell, until they're not.
Yeah. Okay, paint me a little bit of a picture of what this camp looks like, because I'm assuming that people tuning in really are interested in hearing about this, whether they're a patient or a parent or even a caregiver that could actually give some insight to some patients that they take care of. First of all, how was it established? When was it established? And what's going on there?
Well, I can be very economical with an answer and give you a one word answer and say chaos.
Yeah. And what do you mean by that?
As the camp, these are kids from 7 to 17.
Yeah.
And they're all excited to see their pals from last year. Mm-hmm. So it's chaos. But this camp was started by Meg and Cale. Meg had temporal lobe epilepsy as a young adult, thought to be related to a motor vehicle accident. She was in nursing school and really wasn't able to maintain a constant thread of awareness, and investigation identified temporal lobe epilepsy. She ultimately had temporal lobe resection, surgical removal of her temporal lobe, and it essentially cured her epilepsy. And so in her struggles to understand what was happening to her, to maintain her level of normalcy, she and Cale, her husband, who is a school counselor, decided to create the Midwest YouCan Foundation, and to create Camp YouCan. And that was about 12 years ago. And I first was affiliated with the camp about 10 years ago. And we've been doing camp every year since then.
That's amazing.
So the day of drop-off starts with training counselors, all of which are volunteers, and and safety and what to do if a seizure happens, and then when campers start to arrive, the nurses will take in their medications, tubs full of baggies of seizure medicines. And, for medical legal reasons, I have to make sure that the form that is signed by their physician listing their medicines is the medicines that they bring.
Oh, that's good.
So there are some significant medical legal aspects.
Of course.
And then the fun begins.
Yeah.
And throughout the day, there's swimming, there's art, there's archery, there's campfire, s'mores. We have a dance, with a disco ball. There are 3 meals a day, and it's just a legit real live camp.
That's amazing.
Yeah.
That's amazing. And where are the parents at?
So the parents are gone.
They leave.
They drop off and leave.
Wow.
We don't allow parents to stay. And as I mentioned, for sometimes the first time in these people's lives,
of course,
the answer to, can I do that, is sure, go ahead. I'll be right here. And it's an adaptation. It's a way to not only teach them that they can push themselves, but that to normalize what is a really socially isolating thing, maybe at their school or maybe at their church. They're surrounded with people, all of which have epilepsy, and they develop these friendships that span the years. And many of the campers, actually, when they age out at 17, become counselors.
Wow.
Volunteer counselors afterwards. So it's a tremendous benefit.
Absolutely. And it's a traditional camp scenario, as we've all seen, and they probably see their friends going to camp. And until this, there was nothing like that. I'm assuming it's the very first time I've ever heard of this. Well,
there have been, when I was at the University of Alabama at Birmingham, was a camp in Alabama that typically, because we're talking about 50 to 100 campers, these camps typically around the country are hosted at 4-H camps, Girl Scout camps, other established camps that already have counselors. We at our camp staff all volunteer counselors. We cook all the meals.
Wow.
And it's a very small operation. And I think Meg and Kel kind of like it that way. We have maybe 100 campers was the most that we've ever had.
Yeah.
But there are many other established camps like this. There are camps for kids with diabetes, camps for kids with cancer. And I think Meg originally got the idea from her interaction as a nursing student at a camp for kids with cancer.
Wow. Yeah. And, I have been in the healthcare field for 22 years, and I've never heard of this. And this is an absolute joy to hear that it's been established for years. I think education is great because it lets patients know and patients' parents know that there are things out there like this, because I would assume that not very many people know about this. I mean, epilepsy kind of comes at you suddenly. Yeah. And like you said, the problem with epilepsy is you just don't know when. So getting in a swimming pool, becomes a danger. Getting in a bathtub becomes a danger because you don't know when. You're fine all the way up until you have that seizure.
Yeah, I think that's one of the major burdens.
Yeah.
Is the uncertainty.
Mm-hmm.
The other major burden, I think, of epilepsy is the dependence. Some people, unless they are fairly well maintained, had a seizure freedom around 3 to 6 months, they can't drive legally. Obviously, you don't want the risk to society is greater than the burden of the individual. A lot of these people that have epilepsy can't work in their chosen profession because they can't drive a pickup truck, they can't drive a barge, they can't fly, they can't even do the things that are mandated by what's called seizure precautions.
Yeah.
So, I tell my patients that the decision process for what you can do and what you can't do at work is the following. If you were to have a seizure at the time that you were doing what you're thinking about doing and it would hurt you or hurt someone else, then don't do it.
Then
you
don't
can't really do it.
Yeah.
But having said that, being productive, maintaining your work status in an environment that's safe is safer and better than being at home.
Yeah.
So, in some sense, comprehensive support of people with epilepsy really includes making the best effort to keep them employed and keep them in school. Accommodations in school, engagement of the school nurse to know what to do, and accommodations for longer testing times. That's a big issue.
You had mentioned restrictions on adults. I mean, that's hard enough. Imagine the kid with those restrictions. They just want to have a normal life. And of course, we all know that development in a kid is incredibly crucial for how they view life growing up. So in order to give a child with epilepsy, living with epilepsy, the ability to go to camp and have that freedom, like you said, you want to jump in that pool, go for it. You want to do archery, go for it. That kind of stuff, whenever you allow a child with epilepsy to do that for the first time, I can't imagine, of course, in the beginning, how nervous the parent and the child could be. And then second, how liberating it is once they actually do it. So what are some of, tell me a little bit about what these children are experiencing when they're doing the camp. Maybe you have a story about a particular kid who really kind of blossomed in this environment.
Actually, I do. There was a little guy who was in my cabin that struggled on the climbing wall. There's a climbing wall 50 feet. I wouldn't have gotten 10 feet off the ground. Mm-hmm. But he tried it, mustered up enough courage to try it, got about 10 feet, and asked to be let down. And because he was in my cabin, I kept an eye on him, and I saw him kind of pacing. And so he eventually tried it again and got about halfway up. And so for me, that's the spirit of the whole idea of camp, that, it is okay to challenge yourself. And it is okay that you're not defined by epilepsy. Mm-hmm. And it may be that these patients go back to their restrictive environment, but at least they have some reference point that's out there that allows them to maybe challenge the difficulty, the constraints that their everyday life is under.
Yeah. Just a respite of being able to have freedom and not worry.
Sure.
I can't.
It goes for the parents too. I've had a number of parents that have told me that they really had to adapt to the idea that their kid was away from them 24/7 for 4 days for the duration of camp, And that was a hard thing for them, but it was a step in the right direction.
Absolutely. And one of those steps is the medication management, which you're in charge of. That sounds like you've got a pretty good understanding of taking care of the kids there. What are some of the other things that, let's say a parent is listening to this and they want to know a little bit more about how the training, you'd mentioned that there is a conversation with the counselors. You say many of them probably went through the camp and are counselors themselves now. So I imagine that the training comes from that. But let's say someone volunteers to be a counselor. They didn't go through the camp. How are they training them? How are they being supervised? What are they doing to ensure the safety of their kids?
Well, it starts with camper to counselor ratio, and we kind of gauge that based on the cognitive ability of the camper, which can range from normal high functioning to not so much. And so we are able to allocate a counselor one-on-one, and rarely two-on-one, two counselors to one. Beyond that, I don't feel like the camper is really benefiting.
Right.
But it has to do with eyes-on counselors, head on a swivel. If one of the campers goes to sit down, they just kind of wander away. They become quiet. They disengage from the usual banter. Keep an eye on them. If they start to have a seizure, what do you do? If they get confused. And sometimes seizures manifest as just a level of confusion, and the camper tries to walk away. You just passively get in their way and don't let them walk away. And if, they start to stagger and were to maybe fall with a more major motor seizure, you just lower them to the ground, make them comfortable, call on the walkie-talkie, and I will respond. Let me also say that we have registered nurses that volunteer.
Wow.
And the University of Nebraska is in Omaha, the medical school there. And there is also a pretty significant pediatrics hospital and an pediatric epilepsy school there. And so we've got fantastic nurses, and at drop-off, it is utter pandemonium because, every kid comes with one or two siblings, a parent, maybe both parents. They've got to get in line. The nurses have to sort of put all of that pandemonium out of mind and focus on the 10 bottles of medications that are in this baggie that they have to check are on the list provided by the doctor, certifying that it's okay for us to prescribe them. Yeah. And then throughout camp, in addition to responding to various issues, Sally may have had a seizure, she's acting confused, or she's overheated. Could you send a nurse down to check it out? They are dispensing medicines 5 times a day. Wow. So to, dispense 2-3 medicine dosing times per day over the course of the day, plus responding, it's a lot.
Yeah.
And our nurses are absolutely fantastic, amazing. A lot of them are pediatric epilepsy nurses.
Of course.
So we are thankfully very well staffed at our camp.
That's amazing. And what a great gift that they're giving, but also I imagine it's a gift back to y'all by being with these campers and seeing the smiles on their faces.
Yeah. Yeah, and a camper hug goes a long way.
Oh, yeah, absolutely.
And at one of our camps, we used to have a blow-up water slide, like a 2-story blow-up water slide. And it was the height of Dr. Paige's camp to, go all 9 years old on that thing.
And I'm sure they were
So-
encouraging you and egging you on to do it.
So
Come on,
there's-
Dr. Paige.
I get certainly more than I give
Yeah.
with this camp.
That's absolutely amazing. It really makes me want to even look into volunteering. I think EEG techs listening, this might be a great opportunity for you to really connect with the patients that we take care of. And going back to the campers real quick, the education that you had just talked about, is there an orientation that happens before and really you sit
For
down?
campers or for counselors?
Sorry, for the counselors.
For the counselors, yes.
Yes.
I mean, Meg and Kale go through the basics of epilepsy, the types of epileptic seizures.
Oh, wow. So they get a little...
Staring seizures versus motor seizures versus convulsions, and how to respond. A number of these patients, campers, come with rescue medications. So they, the counselors that are comfortable will carry the rescue medications with them. So they have to confirm that they're comfortable and confirm that they know how to deal with this, and what to do, what to expect, what's acceptable behavior, what's unacceptable behavior, and that's another issue. A lot of, I think, disabled children, they're still smart, and they are still little manipulation automatons, like all children are. So we kind of set the boundaries of what's appropriate and what's not appropriate.
Very good.
It's about a half day of meeting, getting to know each other, and team building, goofy team building games with counselors. And so it's really enjoyable. And a lot of the counselors have epilepsy, but a lot are medical students, occupational therapy students, RN students from the University of Nebraska. And that's, part of their education.
Yeah. Well, this is obviously a fantastic initiative that y'all are offering these kids. How do parents enroll their kid in this? And then how long is it? Where is it? And all that kind of stuff.
So the way to get your camper registered is to go to the website. It's just do a Google search on Camp YouCan, YOUCAN, one word, and it'll take you. And there's a registration section. You need to fill a lot of information out because we don't know a lot of these campers, and we have to determine if they're appropriate, how high functioning they are, if they're potty trained, etc. And then there is a fee, which is not always applied if we feel like it's appropriate. There has to be a doctor's form that's filled out to confirm that the medications that we will administer are the medicines that the doctor approves. And you get confirmation back via email, and you show up with a list of things that you need for summer camp.
Yeah.
Bug spray and sunscreen and, swimsuit, flip-flops.
They get the entire typical camp experience.
Sleepaway camp is all-inclusive as we can make it.
That's great.
Campfires, s'mores, ghost stories. It's
And where is it again?
It's southwest of Omaha, Nebraska.
Okay.
So we have to pretty much every year schedule our week with certain established camps. This year it's at a Girl Scout camp. It has been at 4-H camps. So every year it could be at a different camp. Of course, we prefer it to be a single camp. And then we just basically pay to hold the camp at that facility. Sometimes there are counselors provided, sometimes not.
Right. And how long is the camp?
So we started out 3 days, three days and 3 nights. I think it's 4 days and 3 nights now. They come in the afternoon of drop-off day, and they leave by noon the day of pickup.
Let's say the parent is trying to get in, they can't because it's full. Are there other camps, and how many camps are there?
Well, I think there are camps really nationwide, and I know there are lists on the internet of summer camps for kids with epilepsy. And if you're outside of the Midwest area, really Nebraska, Iowa, Missouri area, you can just do a Google search on epilepsy camp. And
then your state.
And your state.
Yeah.
And I think maybe the Epilepsy Foundation of America website may have a section to find out about different camps. And then a lot of times you'll be sent to that webpage and contact information. And, usually these organizations, these camp organizations, they're kind of mom and pop operations.
Yeah.
They really should be. And that's where I think Meg and Cale really want to remain, because they're involved in every level of the operation, along with our Midwest YouCan Foundation Board of Directors. The Board of Directors, we're it.
Yeah. Yeah.
And that's the way we like it. We're camp counselors, camp doctor, cook, and
all volunteer.
And that's the fun of it.
Very good.
It's a good time is had by all.
Well, that's amazing. Well, that's a very cool thing to have and that you're a part of, Dr. Paige. Thank you for sharing that. Sure. For the parents who are looking into enrolling their little camper into camps, I highly suggest that you do what Dr. Paige said. Google the closest camp near you. To those listening who are caregivers, please consider volunteering at one close to you. I know I'm going to look into it. What a gift it would be to see these campers living the best life that they can without really any restrictions, and you can be a part of that. So, Dr. Paige, thank you so much for sharing that, and we'll talk to you in a few weeks about AI EEG stuff. All right.
I look forward to it. Thanks for the opportunity.
Absolutely.